What if your body has already been trying to warn you and you brushed it off? Not because you don't care, not because you're careless, but because the signs seemed ordinary. A few extra trips to the bathroom, a little fatigue, a slight change in performance. Nothing dramatic, nothing urgent. That's exactly why prostate cancer is so dangerous. It rarely announces itself loudly in the beginning. It whispers, and most men mistake those whispers for aging. Today, we're not just listing symptoms. We're decoding them. We're separating what's normal for what's potentially serious. And more importantly, we're talking about patterns. Because cancer rarely shows up as a single red flag. It shows up as subtle changes that slowly stack up. By the end of this video, you won't just know the warning signs. You'll understand how to interpret them. One of the biggest reasons prostate cancer is detected late is psychological, not medical. Men are conditioned to expect decline. After 40 or 50, small physical changes are assumed to be inevitable. Urination changes, I'm getting older. Lower energy, busy life. Sexual changes, stress. But here's the reality. Aging happens gradually and predictably. Cancer-related changes often follow a different pattern. They persist, worsen, or combine with other symptoms. The key is not panic. The key is awareness. Waking up once at night to urinate can be normal, especially with increased fluid intake. But waking 2, 3, or 4 times regularly, that deserves attention. The prostate surrounds the urethra. If it enlarges, whether from benign growth or cancer, it can compress urine flow. The bladder must work harder. Over time, it becomes more sensitive. Here's what matters. Does it feel urgent? Is the stream weaker? Has it become more frequent over months? Occasional disruption isn't the issue. Persistent change is. And when sleep quality declines because of repeated nighttime urination, it affects hormones, immunity, and energy levels. A healthy urinary stream should begin without delay and flow with consistent strength. If you find yourself waiting several seconds before flow starts, experiencing stop and start urination, straining to maintain flow, it may indicate obstruction. Here's the nuance. Benign prostate enlargement, BPH, can cause similar symptoms. That's why diagnosis matters. The mistake is ignoring it. The bladder is not designed to strain long-term. Chronic obstruction can lead to bladder thickening, incomplete emptying, increased infection risk. Prostate changes don't just affect urination. They create cascading effects. Let's address something uncomfortable but important. Ejaculation should not be painful. Discomfort during or after ejaculation can signal inflammation, infection, or structural disruption within the prostate. Because the prostate produces a significant portion of seminal fluid, changes within it can affect nerve sensitivity and muscle coordination. The danger here isn't embarrassment. It's silence. Many men won't report this symptom, and that delay can cost time. Even a faint pink tint matters. Blood in urine, hematuria, or semen, hematospermia, is not normal. While infections or minor vessel irritation can cause it, repeated episodes require immediate evaluation. Here's the critical point. Cancer can cause fragile blood vessels to rupture as abnormal tissue grows. One occurrence? Investigate. Repeated occurrence? Urgent evaluation. Early detection drastically improves outcomes. Persistent pelvic discomfort is often dismissed as muscle strain, sitting too long, digestive issues. But cancer-related pelvic discomfort has characteristics: deep, dull ache, gradual intensification, discomfort while sitting. When abnormal cells grow, they press against nerves and surrounding structures. The pelvis is dense with vital systems. Persistent, unexplained discomfort deserves investigation. Erections require intact nerves, healthy blood flow, hormonal balance. The prostate sits near critical nerve bundles responsible for erectile function. If erections become less firm, shorter lasting, harder to initiate, and the change persists, it could indicate more than stress. Again, this symptom alone does not confirm cancer, but in combination with urinary changes, it raises the index of suspicion. Patterns matter more than isolated symptoms. Burning can indicate infection, but persistent burning without infection should not be dismissed. Inflammation or compression of the urethra can produce irritation. If antibiotics still resolve symptoms, further evaluation is necessary. Pain is a message. Here's where we shift from early detection to advanced warning. When prostate cancer spreads, it commonly spreads to bone, especially spine, hips, upper thighs. Bone pain from metastasis feels deep, worsens at night, doesn't fully improve with rest. If persistent back pain appears alongside urinary symptoms, do not delay testing. This stage is harder to treat, but still treatable. Time matters. Cancer alters metabolism. Unintentional weight loss is never a good surprise. If clothes loosen without effort, energy declines without clear reason, appetite fades, the body may be reallocating energy toward abnormal growth. Fatigue that does not improve with sleep is particularly concerning. Cancer-related fatigue feels different, deeper, heavier, persistent. These symptoms usually appear later, but when they appear early, they should not be ignored. One symptom may be benign. 2 persistent symptoms? Monitor. 3 or more interacting symptoms? See a doctor. The real danger isn't a single sign, it's the pattern. Example cluster: not-time urination, weak stream, erectile difficulty. That cluster deserves evaluation. Add blood and urine, immediate evaluation. Understanding clusters may save years. PSA testing and digital rectal exams are not glamorous topics, but early detection can prevent spread, allow less aggressive treatment, preserve quality of life. Men over 50 or over 45 with family history should discuss screening with a physician. Early prostate cancer is highly treatable. Advanced prostate cancer is far more complex. The difference is timing. Prostate cancer isn't always aggressive, but ignoring symptoms allows it to become aggressive. The biggest barrier to early detection is not lack of medicine, it's hesitation. Men are often reluctant to discuss urinary changes, admit sexual changes, schedule preventive exams. But strength is not avoidance. Strength is action. If there's one thing to remember, it's this. Your body rarely screams at first. It nudges, it shifts, it whispers. Frequent urination, weaker flow, unusual fatigue. Individually, they seem minor. Together, they tell a story. You don't need fear. You need awareness. If something feels off, even slightly, don't wait for certainty. Talk to a healthcare professional. Early clarity brings peace of mind. And if something is found early, it dramatically improves outcomes. Health is not about paranoia. It's about paying attention. And if this conversation helped you think differently about the signals your body might be sending, consider sharing it with someone who might benefit from it too. Because sometimes the information that feels small today becomes the reason someone gets checked tomorrow. Take care of yourself, and I'll see you in the next one.